And so we've got coming up one of the leaders nationally around this idea of decentralized clinical trials and using more digital in technology and more technology in clinical trials. Craig Lipset, he'll be up at the top of the hour. And in the meantime, want to make sure that we're really answering your questions and we are making sure that we're covering the topics that you want to cover. This virtual care topic is a really big part of this digital health reset. There was a lot of energy around virtual care. We had seen some early evidence that virtual care would quickly be adopted in the US healthcare system, quickly being about 10 years, not a year or two. There was a lot of early investments. Billions of dollars went into the virtual care models. A number of platforms were stood up around the virtual care model. And now what we're seeing is that there's a percent of the population, some people are using virtual care, but not everybody. And we're seeing substantial populations of the US dialing back from virtual care. It's not necessarily easy for physicians to use. Jonathan in the chat box just made some great comments about logins and having to go through another dual authentication app and all of this sort of thing. So we're seeing that virtual care, as much as there was a tremendous amount of promise for it, there is a little bit of a pullback now. And so there's a lot of TBD. We're following the studies closely. We're doing some of our own studies, but that virtual care model is something that, in terms of patient outcomes, it's very much in need of a large multi-arm study that can actually dissect the true statistical value and the true clinical value of telemedicine, not just from an outcome standpoint, but also even from an economic standpoint. So what is the cost benefit and how does that work? What's the cost effectiveness of a virtual visit versus an in-person visit? And we know it's obviously it saves patients a ton of time traveling to and from the medical office, either taking off from work or going from home or whatever. So there's a lot of factors to be considered there. And is the clinical evaluation that a physician does as effective over a telemedicine visit, and when is it more effective or as effective in terms of the percentage of visits, primary care, OB/GYN, cardiovascular care, endocrinology, neurology, et cetera. Oncology is an enormous factor there. And you saw some of that as well yesterday. You saw Namita Tandon, the chief clinical trials officer at Walgreens. She talked about how Walgreens understands that ratio, understands that they're not trying to be an academic medical center. They're working in conjunction with academic medical centers. Again, if you missed the Namita Tandon session yesterday at the HITLAB Summit, either online or at Columbia University, again, subscribe to the YouTube channel, HITLAB on YouTube. It's just HITLAB NYC, and subscribe to the YouTube channel. We'll be posting that video, hopefully either tomorrow, Friday, maybe Monday, but it's a truly very, very revealing video on what is Walgreens' strategy. They're in 12 sites today. They're moving to 50 sites by the end of next year. And while they have roughly 9,000 sites around the country, they're looking at maybe moving up to about 500 at full capacity. So that Walgreens is not looking at having every single Walgreens be a clinical trial site. They are looking for very specific Walgreens that have more facility to actually more capacity to do clinical trials data collection, to be able to follow up on some very simple data collection like blood pressure, blood draw, things like that. And so what they have, and you may know this already, Walgreens has about 500 of those 9,000 stores today have health centers in them. So it is a moving target where we're seeing virtual care and now decentralized clinical trials with this Walgreens movement in this. And we generally assume when someone like Walgreens makes a step toward clinical trials, that this is something that CVS will start doing very soon as well, and that Walmart will follow very quickly as well. Every single one of these retailers, they have innovation units. They have units within their enterprise, and they have very specific pathways for innovation, specific stores where they test their new ideas, they test these new digital models. And if those stores see good success with those new digital models, someone like Walmart, for instance, will go from roughly 3 stores around Bentonville and the Arkansas area to 3,000 stores within 6 months. If they see it working and they see a consumer, some sort of favorable consumer signal noise, they have very, very efficient innovation testing grounds where they're able to look at a new idea, see if it's working, and if it's working after 3 to 6 months, move it quickly to all the stores in the country. So that's the kind of idea that we're looking at here with virtual health as well. We're trying to see whether or not virtual health will in fact see that kind of adoption rate or not. We saw some signal noise in late 20 and certainly in 2021. We saw some signal noise from health plans and PPOs and some of the other managed care models where they were adopting these virtual HMOs and these virtual models. And certainly Transcarent has a big chunk of the virtual healthcare model built into their platform through the ACA model, and I'm sorry, the medical savings account model. So a lot of what you're seeing with the model within Transcarent is they're piggybacking off of the medical savings accounts, and they are able to use the medical savings account model to help deliver care to patients through a new type of reimbursement model where providers are paid up front, and we're seeing a much more efficient delivery of care with Transcarent. So it is a revolutionary model. It's very disruptive. We'll see how much it's adopted across the ecosystem, but we are following that carefully as well. Again, any questions that you have, let me know. This is, again, we're now past the midpoint of the Digital Health Summit, and we have a tremendous agenda for the rest of the day today as well. The agenda is extremely interesting. We have Craig Lipset coming up at 3 p.m. and Craig's going to be talking about clinical trials and decentralized trials post-COVID and what is happening there, the risks that he's seeing and what he's engendering right now, and really envisioning as risks for going back to the way things were pre-COVID. At 3:15, we're really lucky to have the global chief medical officer from Microsoft, David Rue, and David's going to be coming in at 3:15 and talking about the digital health world globally and what is happening. How is Microsoft responding? What are some of their countermeasures to Amazon and what they're doing, and Apple, and they're moving into personal care systems and platforms, and certainly Google with a lot of what they've done with Google Health and how they've moved things around, dialed things back a little bit, but what they're doing with Fitbit, and certainly Microsoft. Remember now, as a tech company, Microsoft is one of the major companies out there, given the fact that most of what hospital systems and most of what health plans and most of what life science companies are running for their back office systems, email, document sharing, et cetera, is Microsoft. And that is important to remember that. So as much as Microsoft isn't grabbing headlines with a wristband or with a wearable, Microsoft has embedded in its business model already billions of dollars of revenue coming from healthcare institutions around the country, around the world. And so they're very much in healthcare as a big tech company. So listening to Dr. Ree and hearing what he has to say about what Microsoft is doing next in 2023 and beyond in digital health will be critical. That'll be a lot of fun to hear him talk about that. That's coming at 3:15. At 3:30, we have a colleague of mine from Columbia. She's an assistant prof of clinical nursing at Columbia, New York, at Columbia University in New York, and Upper West Side, Washington Heights. Michelle Alden will be joining us, and she'll be talking about, again, more about the digital health reset and discussing with us some of her perspectives and some of her research in using clinical informatics tools to help, particularly in social media, to help within the next pandemic and really understanding where it's heading next. And for those of you who are familiar with Providence Healthcare, for those of you on the West Coast, Providence Healthcare is the largest private healthcare system on the West Coast. And we're very lucky to have the EVP and chief of strategy and digital officer. She's the person who's really running the digital health strategy for Providence Health Systems with roughly 13 million patients across 12 different states. And Sarah Vasey will be up at 3:45 to talk about digital innovation on the West Coast and at Providence Healthcare and where they're focusing and what they're looking for the next digital innovation. So if you have a digital health startup, a good person to listen to and connect with on LinkedIn as well.